Hello and welcome. In this video, I'll be explaining a question that you might have thought about in times past. And that question is hypertension a twin to diabetes? A number of times you see patients and you're wondering, how come when I hear this patient is hypertensive, I also hear the patient is diabetic? Or when I hear the patient is diabetic, the patient is also hypertensive. So we're going to look at three scenarios to try and explain why this may be occurring. Number one, first scenario is that the patient is initially diagnosed as hypertensive and then down the line the patient becomes diabetic. What could have happened? Number one, there are many medications we use in treatment of the, hypertension. One of such medications is referred to as thiazide diuretics. These medications are effective, but the problem is that sometimes this medication may cause a side effect that results in raised blood glucose level, which is called hyperglycemia. Remember, the problem in diabetes is raised glucose level. And so you have a situation where a medication that's supposed to treat one causes another. I'm sure sometimes some of us feel, oh, I took my car to the mechanic workshop, they fixed something. I'm not saying all mechanics are bad, but at the end of the day, something also got spoiled. Something like that in this scenario. So the patient is commenced on the medication to treat the hypertension, but the side effect is hyperglycemia. And so at the end of the day, this patient that initially was hypertensive now becomes both hypertensive and diabetic. Therefore, it's important for doctors when treating patients or initiating treatment for hypertension to find out whether there's a family history of diabetes, in which case the thiazide diuretics will not be used so as to reduce the tendency towards developing diabetes. The second scenario is a situation where some patients that are initially diagnosed as diabetic then become hypertensive. The reason why this could occur is that diabetes also, a number of times we think about diabetes as just basically a sugar problem. That's really not entirely correct. Diabetes can affect the kidneys and present with what is referred to as diabetic nephropathy. When the kidneys are involved, the problem now results in raised blood pressure because of involvement of the kidneys. So you have a patient that was initially diagnosed as diabetic. The diabetes over time, if not properly managed, damages the kidneys, and then at the end of the day, the patient that was initially diabetic becomes diabetic and hypertensive. The third scenario is a situation where the patient is diagnosed as both hypertensive and diabetic at the same time. One of the reasons why this could occur is if a patient is, say, obese. In other words, the body mass index is 30 and above. And so in such a situation, this patient has possibly metabolic syndrome, in which case the obesity is driving the process that results in both the hypertension and the diabetes. So we've looked at three scenarios. Number one, initially diagnosed hypertensive and then becomes diabetic. Second scenario, initially diagnosed diabetic becomes hypertensive. And the third scenario, diagnosed at the same time as both hypertensive and diabetic. And so are these conditions or disorders twins? Well, yes and maybe no. So it depends on the scenario. If it's in the first and second scenarios, you would say no. If it's in the third scenario, you would say yes. But again, in the first and second scenario, at the end of the day, sometimes these two conditions look like twins. Thank you, and I look forward to seeing you again. Thank you.